You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. Many people assume that pain is a direct indicator of injury or of tissue damage, but in many cases, pain may be more about the brain's interpretation of signals rather than a straightforward damage meter. This misunderstanding can lead to fear of movement and can cause frustration and lack of progress when working with a physiotherapist. Our guest today is Dr. Chad Nowlin, a pioneering physical therapist and the founder of NRG Physio, a revolutionary approach to physical therapy that emphasizes accurate diagnosis and holistic treatment. With a strong background in anatomy and a passion for improving musculoskeletal health, Chad has developed an innovative evaluation process called the Keystone Reset. This process challenges traditional physical therapy methods by addressing root causes rather than symptoms, providing comprehensive and lasting relief from chronic pain. We talk about the common misconceptions that people have about pain and injury prevention, why many people who have not had success with their physical therapist, why this is so, and what the Keystone Reset is and how it can revolutionize physical therapy. Please stay tuned. We will be back in just a few minutes to speak with Dr. Chad Nowlin.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub, everybody. We'd love for you to follow us on our social sites. We are on Instagram, X, and Facebook, and we're at the Health Hub RMC on those locations. Chad, welcome to the show.
Thanks for having me.
You are, let's just start off right away with, your professional background, how you got into this space, and then we're going to really dig down into physiotherapy proper. But how did you arrive here?
It was an interesting loop how I got here, honestly. I was working in construction. My dad built custom homes, and long story short, we built a house for a physical therapist. He owned his own home health company. And so I got to see a little bit about what does therapy look like and what does business ownership look like outside of my dad's business, which was interesting for me. I knew in school that I really liked the sciences, especially anatomies and biomechanics and things like that. I didn't really know what that meant. And so this guy pointed me in that direction. He was like, well, if you like those things, you should check out physical therapy, which at the time for me was kind of I don't know how to describe it. I had already had multiple failed rounds of physical therapy personally. I suffered with low back pain. Suffering was my choice. I had low back pain for a long time. And for about 11 years, from the age of 17 to 28, I saw a lot of chiropractors, did a lot of physical therapy, ultimately no results. So it wasn't until much later that I would figure out how to solve my own problems through some different mechanisms. I thought going to PT school was going to be the answer, where the brightest minds in therapy would, somehow be able to tell me the answers I needed to solve my problem. But turned out that wasn't going to be the case either. But I knew that what I liked to be doing matched up really well with physical therapy. So I ended up working as a technician at a therapy clinic for several years, getting a lot of observation and hours. I did my graduate program to get my doctorate in Arkansas. And then, last year I crossed my 10-year mark.
Well, very good. Congratulations.
Yep.
So now you're well seasoned at what you do. Now your focus is more on corporate wellness, would you say?
Yeah, and that's been a recent shift. When I first started my company, it was exclusive for CrossFit athletes.
Mm-hmm.
And that made it really easy to market. I could walk into a gym, give a free seminar, create relationships and bring those people in to help them solve their problems. But CrossFit taught us a lot about functional movement and pain as it relates to the whole body, not just what's going on at this place that hurts. And so the experience of working with people who were doing really complex movements taught me a lot about the human body and how it works together, and really, thinking about pain differently through a lens of the whole person and through functional movement, and not just through, diagnosis and special tests and all the little things that you do for that one particular area. And that grew, in the clinic for several years. And then we started actually acquiring some corporate clients. And this just opened us up to be able to use our processes and our systems for pain relief to a larger audience. Working with corporations, allowed us to get paid by one person and access hundreds or thousands of people instead of trying to, take them one-on-one. But if it weren't for CrossFit and committing to treating people one-on-one, in a very intentional way, I would have never uncovered what we call the Keystone Reset now. I would have never really learned to understand like how the whole body works together. And that's really paved the way for how we help our corporate partners now with the systems and processes we created out of that.
Yeah, physiotherapy has over the years obviously changed in its approach to people. You talk about being able to work with thousands of people. So we're going to get into that online experience, because I think, physiotherapy, as we look back, is always manipulative, or, you're working with someone one-on-one. This is an integrative show. So work with me in how you've got to this space of being an integrative physiotherapist, because a lot of people haven't had success with physiotherapy. You go for an injury, okay, lift your leg 5 times a day and do this and do that, and then they walk away and they're no better off. Or, we've got a limited scope of time, and then we need surgery. Has the movement, the broad movement of integrative health, impacted physiotherapy? It seems to me that it would. Has it impacted physiotherapy to the point where it's a different space to work in now than it was 15, 20 years ago?
No, I would, and now, of course, there's exceptions to every rule. More and more now, you're going to see cash pay clinicians popping up, starting their own clinics, not taking insurance, which gets rid of the bulk of why the experience is what it is. Physical therapy is never going to be integrative because of the constraints they have with insurance. And now some practices are really unique in that they will use insurance-based therapy as essentially like a lead magnet. It's the low barrier entry, and then the way they set up their process, like upsell, cross-sell, and continuity programs, can start to tie in some of these more integrative approaches, and that's really unique. But the bulk of physical therapy practices that take insurance, they're legally, they can only get paid to treat the diagnosis on the sheet that they got from the physician.
So your mindset doesn't work back to looking at why this is happening, or why you have a lower pain in your back, but that's not where really it's radiating from.
Yeah, you're not going to get that approach if you use insurance, almost ever. They will probably say, okay, well, let's look above and below the problem. But they don't really know how to integrate that into a treatment approach, because they're not looking at functional movement as a whole. it really is looking at, this hurts. What movements can we add to try to make it hurt less? And it's essentially, they're trying to modulate pain with movement, much the same as how people try to modulate their pain with medicine. It's just some external application to try and lower the pain, rather than what do we need to do to solve the root cause of the pain. And we've dumbed this down into a very, very simple workflow to help people understand how they got their pain in the first place. And we're talking about the pain that most people have. It's not the traumatic pain, like the acute thing, the accident that just happened, the motor vehicle accident, or what, something like that. It's, the over time and then all of a sudden, most of the pain that people have, it's like the straw that broke the camel's back. There were lots of warning signs and there was lots of things going on before that happened that led to it. It just feels like it happens all at once. And the way that we describe that, this is the simplest way I've been able to figure out how to put this, is your lifestyle creates stiffness and asymmetry in your joints. Your stiffness and asymmetry in your joints creates movement compensation. Movement compensation over time creates breakdown in the anatomy, and breakdown in the anatomy creates the pain. And so modern medicine looks at the anatomy and says that is the root cause of your problem. And if we solve that anatomy piece, we solve the pain. But the big question is, well, why does the anatomy look like that in the first place? And that's where you have to back up to, okay, well, why is their movement compensating and why are their joints stiff? And you can trace that right back to the fact that people just sit too much. You know what I mean?
So as a physiotherapist, and we were talking briefly off air, a lot of people are disappointed with the outcomes that they have with physiotherapy. Is this because physiotherapists aren't digging enough, or they're not looking at the movement pattern? They're just trying to treat a specific area. Why the disappointment?
Yeah, I think it's kind of multifaceted, and I can tell you this by my experience. And that is, it's very easy when you graduate as an entry-level DPT, just enough to maybe help people and not hurt people, you know what I mean? And you're going to go work in a clinic. And if you're not really the type to push yourself into new and uncomfortable spaces for, what is next and what is better, it's very easy to just kind of turn into a chameleon. You're going to start looking a lot like what everybody else is doing in that clinic, just by the proximity you have to them. And, I remember the first place I went to work, there were 20-year veterans working there that were still doing the same things I had just learned as an entry-level therapist. And it's just like you describe it. It's leg lifts and it's clamshells and it's glute bridges and it's TheraBand, this, that, and the other for the shoulder. And it's these very fundamental basic movements that are really out of context. They're very out of context. And, I really struggle with a lot of the research behind physical therapy. They want you to practice evidence-based medicine, but unfortunately, there's always a camp on both sides. It's, some of the evidence says it works and some doesn't. A lot of the evidence gets to the end and it's inconclusive. And, we want so badly for pain relief to be like the rest of medicine, where A equals 1. It's, this diagnosis equals this treatment. And it's really just not. It's, 1A plus 2B equals 3C, and there's a lot of variables we can solve for. And, the constraints of insurance and the constraints of time with a very high volume clinic make that difficult to do. That creates a negative experience. You're 1 on 4. And so the attention you get, you're not even spending a lot of time with the person who's supposed to have the biggest brain about the problem you have. A lot of therapy is different. Like therapy schools, I've worked with a lot of students over the years, and it was very rare for someone to have the same manual therapy skills that I had, just because of the school they went to. And so there's some big discrepancy between one student coming out and another. And then you've got this effect where people just get stuck doing the same things they've always done without ever really, moving to something higher level. And a part of that is because a lot of the continuing education that you could receive for that, it's an overhaul. Like they teach a model and a methodology that would totally have to reframe how you do evaluation and treatment
So
strategies.
it's a lack of time on the practitioner part as well.
Yeah, and so it's just very difficult to take, the continuing education for what it's worth and then apply it into the setting you're in. Because a lot of these models function like you would be treating one-on-one, but you're going back to a caseload of 15 or 16 patients a day. And so it can be very difficult to break out of that. And so, but ultimately, this is my, if I'm going to have one of the biggest opinions, it's this one. And it's that physical therapy is largely ineffective for a lot of people because they lack the prerequisites for pain relief. There are just fundamentals that the body needs to have for the pain relief hacks and tactics that you could receive in therapy to work. I think largely those things could be effective if these prerequisites were met. The unfortunate reality is that people don't have great systems for screening those prerequisites or installing them in a way that can really benefit people to the highest degree.
And do you find with a lot of therapists, once the pain has been mitigated, that the work stops? And I'm asking this question just from a personal experience. I broke my leg a while back. I was in a cast for quite a long time. And I had a lot of pain. I had a pain in my foot. My foot was probably the worst pain of the whole broken leg syndrome. And once that pain went away, I was cured. Fast forward a couple of years, I can't bend my ankle. My ankle wasn't bothering me at the time because the pain in my foot was so darn sore. So they worked on that pain. And so now I'm at the point where I can't do a squat completely properly because my ankle's frozen. Is that one of the problems that people have? It's that, they're giving the candy to cover the pain, and then that's sort of the end of it, where we need to dig deeper.
Yeah. And you mentioned something there that it's kind of one of our core concepts. Just because it doesn't hurt doesn't mean it's normal. And this is the flaw in people's minds. They just don't know. I think it's also a big flaw in therapy, is that a lot of therapists think when it no longer hurts, it's better. But pain is just a feedback loop. And you can be receiving feedback in the form of pain, or you cannot be receiving feedback in the form of pain. You have to have a system that shows you, okay, if I'm in this feedback loop where pain is telling me I need to make some changes, I need to know what those changes should be. And when I'm not having pain, I still need to monitor those things to make sure I don't get back in the feedback loop of pain. And I would say if somebody is working in the area of pain, they're not working in the right area at all. And this is why people get stuck, is they have some people have a negative experience in therapy, but it's after. It's when they do the things and the pain goes away and then they resume normal life and it just comes right back. And thereby making the therapy ineffective. And there's a lot of things packed into that conversation. But I think a big part of the problem is therapists they're stuck trying to solve pain, which is a symptom.
Exactly.
It's a symptom of the problem, and they're not spending enough time understanding what the problem is. And then it goes back to the constraints of, okay, well, legally, can we even find that problem and work there because of the diagnosis we have on paper? And then secondary to that is, and I have a strong belief that I've built our processes around, which pain relief, maintenance, and prevention should all look exactly the same. because if you do that right, you don't always have a 30 or 40-minute home exercise program. It's very, very challenging to try to wedge a 40-minute pain relief program into somebody's already busy day where they're probably not going to give you that 40 minutes over and over and over, especially if the 40 minutes has no payout at the end.
Do you think that within so obviously physiotherapists have to stay in their lane. That's coming out very loud and clear from what you're talking about. But do you think that there is a bit of missing the ship when it comes to how physiotherapy should be enacted? What I'm trying to get at here is, are we not paying, or are physiotherapists not paying enough attention to movement and trying to correct movement and movement therapy? As opposed to coming in, you broke your leg, you got to get the muscles back. I mean, you know better than most. You hurt your leg, and then it can go up to your hip, your back, your neck, the whole 9 yards. Is movement therapy a piece that you feel should be way more invested in?
Yeah, this is how we run our evaluations. Is we don't look we don't look at pain ever. I rarely ask about it in the context of like, yeah, where's your pain? How bad is it? You know what I mean?
Mm-hmm.
Those just aren't important to me anymore. We kind of have this two-way street type of thing that we do, and it's because we've seen it so many times. And we check all the parts. So we start at the feet and work our way up. We look for pelvis symmetry first, then we check ankles, knees, hips, shoulders, and then anything else that is relevant based on the conversation we've just had with the client in front of us. Now, we take what we see in the parts, and we can already pretty accurately understand what their movement is going to look like. And then we go look at their movement and confirm it. So like when we see stiff asymmetric ankles and stiff asymmetric hips, everybody has these things, regardless of where their pain is. They have these patterns of restriction. Then I know when people squat, they're going to, have breakdown in the spine early in the movement. They're going to have knee collapse in early in the movement or during the transition of movement. And they're going to have like this torsion of the pelvis where one hip sits lower than the other based on the asymmetries they have in their ankle. We always see this. We could also take and look at the movement. We could just watch somebody squat and be pretty confident when we look at them on the table. Here's their stiffness and asymmetry in the ankles and the hips and the pelvis, because this is what a squat that has those things look like. And so we don't create a pain diagnosis like you're going to see in the medical marketplace. We create a functional movement diagnosis, which there's really no terms for it. It's just like, hey, does the movement look and feel like it should? Yes or no? And there's no in between. And if the movement doesn't look like it should, then our job is to, one, identify how can we change that pattern immediately so the pain is decreased or gone. And then how do we solve all the roadblocks to making that movement look and feel as good as possible? And that's how we build our blueprints for our rehab programs.
Perfect. We're going to take a quick break, everybody. We'll be back in just a couple of minutes to continue this conversation.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub, everybody. Our guest today is Dr. Chad Nowlin. As we ended up the last segments, a few things popped into my mind. As a patient going to physiotherapy, they're referred. It's a referral basis for the most part. Are we going into, as patients going into physiotherapy, are we maybe looking for the wrong outcomes, or is there a way of approaching physiotherapy that might be new and novel? For, again, I'm just looking at my own. My ankle's never going to unfreeze. So if I go into physiotherapy with a more of a movement objective, is that something that you find is making its way into physiotherapy?
Yeah, and you mentioned a couple of things there that I think are important. You probably have a self-limiting belief about your ankle that's going to make that
Maybe.
problem much harder to solve. The body has near infinite capacity to change, and unless your joint, like the bones, have fused together, you can always make progress there, and probably much more than you think in a much shorter amount of time than you think. But I think the people's objective going into rehab is pain relief, and I do believe that is the wrong objective. But it's not their fault, because this is the message they've been fed by, mainstream media and the doctors. It's like, yeah, if you want to be pain-free, go here and do this thing. And pain relief is achievable, and we want that for everybody. But if you make pain relief your goal, you'll always quit too early, and you'll never do the things you're supposed to do to stay pain-free over long periods of time. And the true objective of therapy should be to uncover and restore why that pain developed in the first place. And when you go there, it requires looking at more things than just the joint that hurts, and that's okay. And this is where a new wave of therapy is really needed, where it's safe and okay and reimbursable to look at everything and understand how, the sum of all the parts is way bigger, and so people want to just work on the parts and magically get better. And it just doesn't function like that. We have a saying: pain is not a medical problem, it's a movement problem. And if movement is the problem, movement can't be the medicine. Mm-hmm. Now, I understand in the context of longevity and fitness, movement is medicine, because a lot of the chronic preventable disease can be solved with movement. But pain, the symptom of pain, cannot be solved just by adding arbitrary movement into the mix. The process has to be about changing the way you move, because if you don't change the way you move, you won't change the way you feel. If you continue to move with the same patterns that lead to your pain, you're always going to come back to your pain, given enough time, repetition, weight, or aging.
Well, tell me this then, Chet. The model here in Canada, you're referred, you have your insurance, but there's a cap on how much you can put towards physiotherapy, right? So, I mean, if you are knowing that you're getting 3 to 5 sessions with your physiotherapist, I guess a lot of people walk in, they're saying, well, if I only have that much, my key target is pain. So, this whole way of going into the system kind of needs to be changed, doesn't it?
Sure. Yeah. And that's both, that's probably everywhere.
Yeah.
Yeah. I think there's a couple of things. Healthcare is great. American healthcare is the biggest train wreck on the planet. I recognize with any healthcare, there are pros and there are some cons. People, I think, need to get more comfortable paying for what is valuable, because you get what you pay for. And if you're not paying for it, you're probably not going to get much from it. Mm-hmm. But let's just say you do have your 3 to 5 sessions. It would be so much better to teach you the things you need to do to become pain-free than try to minimize your pain in those times, because then you walk away with real tools in your toolbox and an understanding of, this is why I have pain, and I'm just going to need to work on these things if I'm going to expect pain relief. And that goes back to the fundamentals of pain relief, the prerequisites that I talk about. And it's just such an interesting dynamic people have in their mind, where, we cede control over to somebody else. And then when they don't give us back what we want, you're frustrated by it. When the truth is, you hold all the keys to solving pain yourself. That's such an interesting thing about, the musculoskeletal system, is that you can diagnose it yourself, you can treat it yourself, if you have the right information, tools in your toolbox, and know what to do, when to do it, and how to do it. And that's a learnable skill. And, that's one of our main goals. Is like, hey, I'm going to take everything that I've learned in the last 15 years as a physio and just teach you how to do it. because I've condensed it down into the most fundamental things you need to do to be pain-free. And all you have to do is learn them. And once you learn them, then you don't need a physio ever. And if you do, it's your next best decision, not the only decision you have.
Well, tell us about the Keystone Reset then and how you go about working. And this lets you leverage working with many people as opposed to one-on-one clinical experiences. So tell us about how that works and really who this is for.
Sure. Yeah. So the Keystone Reset was kind of a mind-boggling discovery. It's been 3 or 4 years ago. Still crazy. Still crazy to see it work today. Even though, at this point I've seen it thousands of times. But because I had always chosen to check every joint, we were just able to identify patterns in restriction for everybody, regardless of pain, hip, knee, shoulder, back. Everybody had the same patterns of restriction in their ankles, their hips, and their shoulders primarily. And
now, can I stop with just one quick? Would this be the same as improper movement as it would be for an accident? Are they different?
it's largely the same.
Okay.
People who have an accident are going to have acute pain. Largely, they get stuck in pain patterns because they had all these restrictions pre-existing the accident. And it's just like squeezing lighter fluid on the simmer all the time.
Okay. Sorry to interrupt. Go ahead.
No, that's a good question because people need to understand you're going to get over the initial acute pain of an accident or injury. The pain that lingers beyond that you're like super uncomfortable with, that you wish you could get rid of, are going to be traced back to the restrictions you had before you ever had the accident. They're just holding you in this pain pattern. But what we found that was super interesting was people had varying degrees of restriction in all the prime moving joints, ankles, hips, and shoulders. But 100% of people with pain had an asymmetric pelvis. And this was something that I classically only checked and worked on for low back pain specifically. But I had one client, it's been 3 or 4 years ago, who was explicit. I have low back pain and shoulder pain. And just through my natural flow of evaluation, I start at the feet, I work my way up, I finish with the shoulder. I was like, hey, I'm going to do this quick technique for your low back, and then I'm going to come back and work on your shoulder. And so I did this technique to restore symmetry to the pelvis. They had release of back pain within minutes. And then I went back to the shoulder to start working on the restrictions that we had found, which this particular person, they were limited by about 40% in all the different directions that we check. When I went back to the shoulder, it was completely normal. I'm talking about like full overhead, full front rack position, full external, internal rotation, totally normal. And this was an eye-opening experience for me. So I checked for the next 10 clients that came in. Hey, if we do this here, does the shoulder change? And every time the answer was yes. And so after those 10, I did another 50, rechecking all the joints. So it turns out if the pelvis is asymmetric and you correct that first, it totally changes what the mobility looks like at the ankles, at the hips, and the shoulders. And so if you just take that at first glance, you're not getting the most accurate version of the truth. And so if you're going to build a correct blueprint, this centerpiece really needs to be in its best alignment first, because it has huge dynamic capacity to change everything above and everything below, so that now we can work on the most correct asymmetry, the most correct stiffness in all the joints, because the only way you can change your movement is to change the joints. That's your operating system for movement. If the joints don't move, your movement's going to compensate. And so the only way to get rid of compensation is to decrease the stiffness in the joint that creates it. And that's just kind of how we follow back from pain to lifestyle and from lifestyle to pain. So the Keystone Reset really opened the door for us to be super comfortable with building legitimate blueprints. Like, hey, if you're going to change the way you move, these are the things you need to do in this order. And we've always taught people. We bring them into the clinic and we teach them how to do this stuff to themselves. Like, I'll show them, hey, this is what it feels like to stretch your joint, mobilize your joint, rather than just stretching a muscle. And I'll show them the difference. And just over time, we teach people, how do you mobilize your own hip joint capsule? How do you mobilize your own ankle joint capsule? How do you mobilize your own shoulder joint capsule? And we teach them these things, and then we send them the videos so they can have a visual refresher at home to just go do this stuff. And ultimately, that's what led us into the technology space of we really don't view this as physical therapy anymore. We view this as the fundamentals of taking care of your body and understanding how it works. It just turns out that when you do these things, pain goes away. But then if it doesn't, then going and getting dry needling or some of these advanced tactics is probably going to be 10 times more effective because you've already started ungluing all of these sticky joints and problems with your movement. And now we can take it one step further with an advanced technique. But it just allowed us to systematize everything into a digital format where if you can watch a video and follow along, you can take care of yourself.
So no manipulation is needed for the pelvic area, for anything like that. Everyone can do it on their own.
Yeah, it's needed, but we've just designed how to do it to yourself.
Does your program offer sort of live consultations with physiotherapists, or is it all completely online downloadable?
Yeah, so it's like e-course format.
Okay.
It takes you through how do you check your own ankle? Does it move enough? Yes or no? What's your asymmetry if you have one? And it just walks you through each joint, ankles, hips, shoulders. How do you test to see if the pelvis is asymmetric? It's very easy to do. And then from there, we go to Keystone Reset. How do you self-manipulate the pelvis back into a neutral position? And then recheck your joints. Do they look the same? Probably not. Okay, what was the change? This kind of creates an aha moment where it's like, oh yeah, well, just when I do this, it allows me access to a lot of new stuff without doing anything else. And then it's like, okay, now just take a look at your sheet. The ankles are stiff, the hips are stiff, the shoulders are stiff. How do we start systematically changing how well your joints move? And then our online process, as far as like consultation goes, it's really more on the side of movement coaching. So people can understand this is what good movement looks and feels like. So we can do movement analysis, show everybody, hey, this is like how we break down movement. Nobody's a special snowflake. Anybody with a mechanical fault in their squat, it looks just like somebody else's. The body only goes into these positions in the same way for everybody. The knees cave in, the feet pronate in, the shoulders rotate out. The errors that we see are always the same, just to varying degrees. And then we coach people, okay, here's how you need to think about using this program to change that. Here's an advanced technique you can add into your program to maybe make some additional progress. But we do it in group coaching format. It's not about pain, so we a lot of people's questions, well, what about HIPAA? It's like most people are out spewing the fact that they have pain all over the internet and to their friends and neighbors anyway. So it's not really a HIPAA concern, but we're not viewing this as a medical problem. We're viewing it as a movement problem. We're just going to teach you how to move well and show you how to break down all the barriers between where you are today and the best version of movement you can have in the future.
You mentioned the squat a couple of times. We're kind of running out of time. A couple of questions left. Is a squat one of those movements that you use to judge overall movement of joints and things? Is that like a key movement for you?
Yeah, we have three. It's the squat, the deadlift, and the overhead press. And obviously, those are the simple terms for them. Mm-hmm. That could be, how do you get up and down out of a chair? How do you bend over and pick something up? And how do you lift something over your head?
Got it.
So that could range from anybody who's not in the gym all the way to some of the highest level, Olympic lifting athletes. But our big push is we use our process to microdose fitness into the game. You can't restore mobility without functional movement. And you can't functionally move your way out of a mobility restriction. You need both. And so we follow this process called loosen, lengthen, load that walks people through loosen the joint, lengthen the muscles around it, load it into a functional movement, because if you don't use it, you lose it. And we use that to try to help push people into the fitness space. Mm-hmm. Because the other side of that coin is we don't believe that weakness causes pain, but we do believe that people can be so weak that their lifestyle is just, it's more than their body has capacity for, and that can lead to additional breakdown. And so there's no like the research on longevity, it points straight back to strength.
Yeah.
And so we want to start pushing people not just into how do you take care of yourself so you can be pain-free, but as technology starts to extend our lifespan, how can you extend your health span, which is a term by Dr. Peter Attia that he uses in his book, Outlive. And it's a phenomenal, it overlaps some of our concepts really well. Like strength is armor. And you can use the gym to restore and rebuild your body and live a pain-free lifestyle, which doesn't mean you're going to be pain-free 24/7, 365, but the lifestyle supports the opportunity for pain relief, whereas the other lifestyle does not. And that's so important.
The one question I'm going to have to end here with, physiotherapy. When I was back in physiotherapy a few years ago, I was always hooked up to a machine, either at the beginning or the end of the machine was a machine was a part of my physiotherapy. Obviously online, there are no machines. Is that something that necessarily has to be missing from an online platform, or do you recommend people to go to different spots to get some work done otherwise? How do you handle that aspect?
Yeah. So I've never used any equipment.
Okay.
Yeah. If you can't do it yourself, if you can't take it home with you and do it yourself, it's not worth doing. Because, I mean, especially in Canada, you're going to get 5 sessions on IFC. It's like, great. Well, then what? You know what I mean? You need strategies that work that you can do on your own, or it's not worth doing. And this is one of my least favorite things about the current state of physical therapy is there's a message of if you just keep doing it, it will eventually work. And that's not true ever. They'll say like, hey man, I'm doing this thing, but it really makes me hurt. Well, just keep doing it and it'll eventually get better. No, that's your body telling you don't do that. I don't know why people want to waste time with things that they can't do on their own, and they don't make them better immediately when they do it, because there's so many things that you just need to identify. Hey, I spent 4 minutes doing this and this was my positive result. Great. Let's just beat the heck out of that thing until you don't have pain anymore. And that really just needs to look like these are your daily rhythms of self-care to make sure you can move well when you move. And it shouldn't take more than 15 minutes ever. It should blend into your day very naturally, and it shouldn't include anything that you can't do on your own.
Can we use this as a preventative? Or is this directly a physiotherapy induced, I have an issue? That would be the great thing, right? To have everyone move properly, because it's a preventative system that we can sort of incorporate into our daily lives.
That would be the best. We have found it challenging to separate people from money for a problem they don't think they have. But the truth is, if you don't have pain right now, you've got all the warning signs that can be discovered. You've got the stiffness, you've got the asymmetry, you've got the movement compensations. It's just a matter of time, repetition, or load before it reveals that to you in the form of pain. So obviously, we'd love to catch people before their body hurts. It's way easier to solve the problems then. So yeah, definitely can be used preventative, but it's the human condition. If it ain't broke, don't try to fix it. And people don't think they're broken until it hurts. So it's just that's a struggle to navigate.
Where can people find out more about the program? Is there an avenue to speak with you directly? How do we go about that? And obviously you're online, so Canadians are open to the system as well.
Yeah, sure. Right now so we've got at NRG Physio on Instagram. We've also got at Dr. Chad Nowlin. That's a more spin towards our corporate partners, which, if anybody's listening who's looking to bring something to your employees and save a bunch of money on your health spend, could be a good conversation there. Content's very similar. Some of it's organized just a little bit differently. Currently working on my website, chadrnowlan.com. You can find some interesting stuff there. Probably not a great way to get in touch. You can go there and book a call with me, though. And that's a direct line to me. Just links you straight in. Always looking to have conversations with people. And then I can keep you posted. We're about to launch a webinar series that will give people, many people at once, access to come in, see the process unfold in its entirety, so they know, this is what we're doing, this is where we're going, this is how it works. And that's going to be a great way for people to connect and get a lot of info. Is through these webinars that we'll be holding weekly, probably starting in the next 4 weeks.
Yep. Do let me know and I will pass on. Just a clarification, if a corporation is interested in your product versus an individual, are they the same thing? Just accessibility is granted with a corporate space?
Yeah.
Okay.
And obviously we've got some different things we want to track from a corporate perspective. Engagement's important. We're really looking to drive down to less musculoskeletal health spending out of the company, because companies are paying for that through their self-funded health plans if they're large enough. And then the other thing is, smaller organizations that don't necessarily have the funds to provide a lot of these upper level benefits that are really costly is an easy way to add a good physical health benefit to their employees for much cheaper than like some of the insurance-based programs that you can get into. And we talked a lot about pain today, but a huge part of our process is our 4 doorways, which is pain, fitness, nutrition, and sleep. All of these things lead into the same big room that's really recovery. And how do you do that well? And you can't separate that from fitness, nutrition, and sleep. So those are all really important conversations to be had.
I would think that this is a great program for people who are thinking about getting into the gym and thinking about starting. If your movements are proper, the less chance you have of injury. We hear so much about weightlifting and strength, and I'm still on the fence with the fact of how heavy you have to lift and how much you have to do. But if you're doing it properly, you're going to get much more benefit. Thank you so much. It's a very interesting show. I really appreciate you being on the show today. We'll get all the information out to all of you guys if you want to further yourselves with information. But Chad, thank you so much for joining us.
Yeah, absolutely. It's been great being here. Thank you.
Everybody, we'll talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.